health problems. Sheep and goats can get a lot of different diseases, and I've kind of organized them into these groups: parasitic diseases, respiratory diseases, hoof diseases, reproductive, metabolic, and other diseases. And again, it's not going to be every disease that they can possibly get. And at the same time, there's probably a couple of significant diseases that I might have forgotten. I actually thought of a couple that I didn't include that I could easily have included. To me, the biggest disease problem with sheep and goats is parasites. And there's two kind of general categories of parasite. Really, all a parasite is one organism that lives kind of off of the other one. They're not always negative. In fact, a lot of parasites really don't have a negative effect on the animal. A lot of them do, and it's usually an issue of too many. Like I always try to remind people that, Jeff, you want to try the audio again? Jeff, I've enabled your audio if you want to give it a try. For the person with no audio at all, you must be having the same problem Jeff has. Maybe you're with Jeff, I don't know. Okay, so parasitic diseases. Two general categories: the internal or endo and the external or ecto. Within each of these groups there are different kinds of parasites, different groups of parasites, and I want to talk about the main ones in each of these respective groups. The internal parasites, let me back up to the last slide. There's basically two types of internal parasites. One is the helminths, which are the multicellular parasites, much more complex organisms, and then the protozoan parasites. And really, both of these are extremely problematic, particularly kind of one parasite in each of those groups. And then within the external, we'll go into some of these different types of external parasites. So within the helminths, or the multicellular parasites, the primary problem that we have is roundworms. And they're exactly that. They're round. They have a reproductive system. They have a digestive system. They're actually far more advanced than you might think. Sometimes we call them nematodes. Within that group, we have what we call the strongyle-type worms. And then within kind of, like if you take a fecal sample to have done, the fecal egg count that you'll get will be for strongyle-type eggs in general, not for each specific of these types of worms. So within these type of worms, we have two primary kinds. One is the blood-feeding parasites, of which Homunculus contortus, the barber pole worm, is the primary problem. Hookworms aren't very common, not pathogenic. The eggs look basically the same. And then what I know they call them in the UK, they call them scour worms, the worms that cause more of the digestive problems or the digestive symptoms. And there's a list of 6 of these, and really there's only 2 that we tend to worry about in terms of their numbers or in terms of are they pathogenic? And that's the brown stomach worm and the hairworm. And then also realize that lungworms and meningeal worm, which is the deer or brain worm, they are also roundworms. Jeff, if you can find a way to speak, you can take over this presentation. Jeff has mic privileges, but beyond that, I don't know what I can really do from this end. So again, the strongyle-type worms that are important to us is Homunculus contortus, which is commonly called the barber pole worm, Sometimes it's called a wireworm, sometimes it's called a large stomach worm. But for the most part we call it the barber pole worm because it kind of looks like that thing on the outside of a barber shop where you have the red and white and blue that kind of go around. So the female barber pole worm looks very similar to that. The white color would be your ovaries and the red color would be blood. So the barber pole worm is a blood-feeding parasite. It goes into the abomasum, which is the first stomach. And what it causes in the host animal is blood and protein loss, or anemia, bottle jaw, which is an accumulation of fluid under the jaw, and sometimes just sudden death. The other parasites that are important but of secondary importance are what we call Trichostrongylus and Teledorsasia, which we used to call Ostertagia. These are the parasites that, again, they cause the digestive symptoms. And yes, the abomasum is last, I'm sorry, not first, but it's the true stomach. And so that's where the barber pole worm takes up residence. So we get with these worms things like weight loss, diarrhea, production loss. Very generic symptoms, so it's hard to know, what the cause of those things. Definitely very secondary, particularly in the summertime. But usually an animal has a mixed infection of these types of worms, and not even just limited to these types. When we have send in a fecal sample to determine what species of worms that we have in the goats at our research center, we'll get some of the other ones on that previous page, but they're not too significant. Yeah, the order of the digestive system is the reticulum, the rumen, the abomasum, and the omasum. So collectively, these worms are difficult to control, and one of the reasons is because they have short, simple life cycles. Short meaning probably 2 to 3 weeks for the worms to complete their life cycle. It's very weather dependent, so I would say sometimes in the middle of summer, probably as short as a week for the barber pole worm, and certainly further south it's going to be shorter. And then, but probably on average it's about 2 to 3 weeks. They don't have an intermediate host, which means it's a very simple life cycle. They don't depend on something else to complete that life cycle. The other thing that makes them difficult to control is, and this is what's occurring this time of the year, at least in our temperate climates, is they go into a hypobiotic or arrested state. So they're in the animal, but they're kind of in limbo. But once the weather changes, they'll kind of wake up and resume their life cycle. There was some research done in Michigan. In fact, it was written up on our consortium website that most of the worms that survive over the winter, they're not surviving out on pasture. They are surviving in the animal. So how do you control these? And this is just one slide, and yet it's incredibly complex. And of course we've talked about a lot of this stuff in our other presentations. So while I've got it here on one slide, we can spend entire courses talking about these things. Ideally, we want to do things from a management standpoint that's going to minimize the number of animals that actually need treated. And we've talked about some of these, pasture, rest, and rotation being the key. Probably the rest being the most important. How soon are those animals going to come back on that same field? The reason parasites maybe weren't a problem in the old days or before there were fences is because animals never grazed the same area twice. They were migratory. Well, as we fenced pastures and we made them smaller, they're grazing the same pastures. So the ability to rest pastures, probably about 2 months to get a relatively clean pasture in our climate. Clean pastures, That can be a new pasture, that can be a pasture you use once a year, that can be a hay field that you graze once a year. Annual pastures, same concept, clean, mixed species grazing, and here I'm talking more about beef cattle and horses. They don't share the same parasites. Forages that contained condensed tannins, things like Sericea lespedeza, bird's foot trefoil chicory. Browsing, you know, a goat is not a grazer, it's a browser. If you have some opportunity on your farm for goats to browse, they're not going to get infected with parasites if they're browsing, if they're up grazing high, up on their hind legs. Sheep will do some browsing as well. Maintaining minimum grazing heights. If you're grazing below 3 inches, you know, you're kind of asking for parasite problems. If your pastures are below 3 inches, get them off. Get them off of them. Zero grazing. If we put animals in dry lot, they really don't have a source of infection or reinfection. Genetic selection, considerable differences between sheep and goats as species, considerable differences between breeds, both within the goat and sheep species, and also within the breed or herd itself. There's considerable difference. It's been shown that about 20% of the animals are responsible for about 80% of the infection that goes out onto the pasture, of the fecal egg count. So there's a tremendous opportunity to select animals that are more resistant. And of course I've mentioned already that at our buck test, that's one of the things we're attempting to do, is select bucks that are more resistant. So we want to do all these different things to minimize the number of animals that need treated. But I think most of us recognize that some animals, particularly some of the younger ones who haven't developed immunity, are going to need treated. And this is where we want to use something, what's called the FOMACIA system. And you can see it pictured here, where you use that card. The card is much smaller now, but you put that card up against the eyelid to see if that animal is anemic. Because again, anemia is the primary symptom of the barber pole worm. They extended the FOMACIA system to what's called the 5-point check. That checks 5 points on the animal's body that helps you make a decision on whether that animal needs dewormed. So we do all these things to try to minimize the ones that need dewormed, and then we selectively deworm animals. Okay, and then the key is when an animal does need dewormed, that you give it an effective dewormer or anthelmintic. And how do you know if it's effective? Well, you need to test for resistance. You can get some idea if you take a before and after fecal egg count for an individual animal, but you're going to know more if you do a lot more animals, or you do what's called the Drench-Wright test, which we talked about last week. But if you don't do that test, some before and after fecal egg counts can be helpful to tell you if an anthelmintic works. Industry-wide, the most effective dewormer tends to be levamisole or Cydectin, and the least effective ones tend to be ivermectin, Safeguard, and valbazen. And as I mentioned in a previous class, we are getting a new dewormer that will be effective against all these resistant worms. Just not sure when it's going to come on the market. It won't be approved for goats, and it'll probably be quite pricey. Okay, what about the other roundworms? There's basically two I want to talk about here. First one is lungworms, and there's two different species. One requires an intermediate host, one doesn't. Where the barber pole worm is a warm weather, actually even historically a tropical parasite, lungworms are more of a wet climate, so in wet conditions. How do you know if your animal has lungworms? Well, there's usually no signs of infection. You really don't know. Just because an animal coughs or has a runny nose, that doesn't mean it's lungworm. In real severe cases, you're going to see these respiratory type symptoms: coughing, rapid breathing, nasal discharge. They're just going to kind of go downhill. I think the lungworm is also opportunistic. If you're having problems with the stomach worms, which are far more of concern, that can make them more vulnerable to lungworms. You won't find the eggs in the feces, but you may be able to find the larva. And I know it's a different technique that I'm not familiar with in terms of being able to see the larva. I suspect most cases of lungworm are diagnosed via necropsy. And that's why I say it's tough to know if your animals are suffering from lungworm. Most of the anthelmintics or dewormers that we use are effective against lungworms. They say that levamisole you should probably use twice. But generally, sheep are pretty resistant to lungworms. And again, I think it's opportunistic. If there's a lot of other things that are compromising the animal, you might have a situation. Perhaps they're more problematic in goats, especially young kids. But I've read or seen nothing that would make me think that lungworms is a significant problem. It would be more of an isolated problem. There's a lot of diseases that tend not to be a problem, but that doesn't mean there can't be isolated cases where there's a significant problem. Perfect example is meningeal worm, which is sometimes called the deer worm or the brain worm. It's not a problem for most farms, but there can be a situation where it's the major problem because of their circumstances. So the meningeal worm is a parasite of white-tailed deer, and it's not really pathogenic to them. That's why I say not all parasites are problematic. If a sheep, goat, alpaca, llama, moose, even a horse gets this parasite, then a lot of problems can happen because they're an unnatural host. So instead of the parasite completing its life cycle, the sheep or goat or camelid is a dead-end host. So once that parasite gets into the central nervous system, it wreaks havoc. There's no eggs in the feces. There's no way to identify it from that because they're an unnatural host. It does need an intermediate host, which potentially gives us a point of potential control, and that's a snail or a slug. So they ingest it in their digestive system. After about 10 days to 2 weeks, the parasite moves to the central nervous system, so it causes neurological symptoms, eventually paralysis, eventually death. Some animals will get better on their own. Some animals won't get better no matter what you do, and some animals will respond to treatment. The drugs of choice, and all of the dewormers have at one time or another been used to treat the meningeal worm, is fenbendazole, which is safeguard, ivermectin, and then anti-inflammatory drugs. You notice every time you see RX, I mean that to indicate that you need a veterinary prescription to use that drug for that purpose. How do we prevent the meningeal worm? I have a question mark here because it's pretty difficult. Some of the people with alpacas used to deworm once a month with ivermectin in hopes of killing the parasite when it was in the digestive system. It's not known if any of the drugs will cross the blood-brain barrier into the central nervous system. So that was one method. The problem, of course, with using ivermectin on a monthly basis is you're probably going to render it useless for stomach worms because it's these frequent treatments that cause the drugs to become resistant. Is there an opportunity to control the snail or slug population? You know, I don't know. Keeping animals away from those habitats is another potential. So while industry-wide this is probably at the top of the list, on some very specific farms, and I can say a lot of them in the mid-Atlantic area where we have a lot of white-tailed deer, this can be a very large problem. We had an outbreak at our research center the very first year we ran small ruminants. Okay, so those were the roundworms. Now we have the flatworms, cestodes, and then the flukes. Okay, so tapeworms. Tapeworms are the only parasite that we can actually see in the feces. You know, normally we use the feces to see if there are any eggs in there, and of course that's microscopic, so we can't see anything. But we can see tapeworm segments in the feces. And what that tells us is, yes, the animal is infected with tapeworms. Just like if we see eggs in the feces, that means that animal is infected with that parasite. Doesn't mean that that animal is clinically parasitized and needs treatment, because again, not all parasites cause problems. The tapeworm requires an intermediate host to complete its life cycle, which is about twice as long as the stomach worms. But all it needs is a pasture mite, and there's plenty of those. For the most part, tapeworms tend to be non-pathogenic, meaning they do not cause problems, and that there is no benefit to treatment. Of all the research that's been done, overwhelmingly, it shows that you get no bang for your buck when you treat for tapeworms. Now, I'll be the first to admit all the research is with sheep. Might goats, particularly kid goats, be more susceptible? I guess I don't know for certain. I know that when we see tapeworm segments in our research goats, or the goats at our research center, I don't worry about them, because I don't find them to have never had any indication that they're a problem. We think they're a problem because they're the worm we can see. If you do end up treating for them, albendazole is the only drug that's labeled to kill tapeworms, and they just kill the adults. Albendazole is valbazen. It is also got a conditional license for goats. Actually, I think that's for liver fluke, not for tapeworms. Fenbendazole or Safeguard, if you increase the dosage, which makes it prescription, it can be effective against tapeworms. The best drug for tapeworms is called praziquantel, and the only way to get this drug is in a horse dewormer called Quest Plus, and once again that would be prescription. There is another tapeworm that sheep and goats are actually the intermediate host for. It's actually a dog tapeworm. It doesn't bother the dog, doesn't really bother the sheep or goat, but causes there to be a cyst in the meat, which even then isn't a problem for people eating the meat, but it's kind of unsightly. It's called sheep measles, and the control point is the dog, not the sheep or goats. Flukes, trematodes, they're kind of oval shaped. They kind of look like a little leaf. They require an intermediate host, which is a snail or slug. They have a significantly longer life cycle. How you would diagnose this is you'd find eggs in the feces. More likely than not, you would probably discover it in a necropsy. Obviously, liver flukes does extreme liver damage, and you will actually see the flukes in the bile ducts. So they cause liver damage and hemorrhaging, which means the symptoms are similar to the barber pole worm. They're anemic, pale, bottle jaw, sudden death. Albendazole or valbazen is the only dewormer that's effective against adult liver flukes. Clazental is a prescription drug, and it's contained in the cattle dewormer called Ivermectin Plus. So again, they would require prescription. Liver flukes aren't considered to be a national problem, and probably even from an international standpoint, you know, it's not going to be. I don't think they're a problem in Queensland, where it's dry. You know, this is a moist, again, a cool, wet weather animal. In the United States, they're thought primarily to be a problem in the Gulf Coast states, especially Florida and the Pacific Northwest. I think even up around the Great Lakes as well. The only thing I tell people about liver flukes, say in my state or this area, is just remember the animals don't always read the book, and while we're not supposed to ever have liver flukes in the Mid-Atlantic area, I would never completely close out the idea, particularly if we have some unique weather conditions. I'm sure it would depend primarily on the intermediate host. But for some of you that are logged on tonight, you're probably in areas where liver flukes can be a significant problem. They can also be imported. We have a farmer in our county that brought in feeder lambs from Michigan, and I think he brought in some liver fluke disease. So keep that in mind as well. Okay, now moving on to the second group of parasites is the protozoan parasites. They're single cell, And here we're talking predominantly about coccidia. There are others, but they're not significant problems. Cryptosporidium, giardia, they're not significant problems in sheep and goats. So this is a single-cell protozoa. The most important thing to understand about coccidia is that it is species-specific. You know, you spread poultry manure on your pasture, it's not going to be problematic from a coccidia standpoint. Even sheep and goats are affected by different strains of coccidia. Also, not all coccidia are pathogenic, which is what makes fecal sampling challenging, because you don't know if the coccidia you're looking at are actually pathogenic. They do have a more complicated life cycle than our roundworms. They form spores. There's part of their life cycle where they do asexual reproduction, so it's a little bit more complicated. In fact, the coccidiostats will actually attack different points within that life cycle. Coccidiosis, much like our roundworms, affects primarily young animals, 1 to 6 months of age, especially weanlings. A lot of our control of coccidiosis, or potential control, is targeted towards that weaning time because we know that they're very vulnerable. Our adults are largely immune to coccidia, but they serve as a reservoir for infection. So they are shedding the oocytes, but it's not affecting their health. You know, if somebody tells me that they have an adult that needs treated for coccidiosis, I'm a little bit reluctant to believe that, because so many diseases, pathogens, bacteria, the whole idea is you develop immunity to them. And while sometimes sheep and goats are a little slower at developing immunity, ultimately they do develop immunity. Most coccidiosis is actually subclinical, about 95% of it. So even though you don't think you're having problems, you probably have a certain low level of coccidiosis that's affecting the performance and productivity of your flock or herd. But we do get clinical coccidiosis where we have to intervene and help. The primary symptom is diarrhea, although an animal can have none and still be suffering from coccidiosis. You can have mild diarrhea, you can have very severe. If you've got young kids and lambs and they just kind of look bad, you know, they're failing to thrive, they're not eating, they're lethargic, you know, this is a good indication that it's coccidiosis. They have dirty hocks, their goats, their coats look rough, their fleece looks rough. Those are good signs that they're coccidiosis. Just like stomach worms, I would recommend that you make a decision to treat for coccidiosis primarily on clinical signs. When an animal has coccidiosis, we need to drench them, meaning individually treat the affected animal either with chorid or a sulfa antibiotic. Dimethox is an example of one of the sulfa antibiotics. I would definitely recommend the sulfa antibiotics over chorid. You need to treat for 5 days. Again, the RX means it's by prescription. None of the drugs used to treat coccidiosis are approved for sheep and goats. Supportive therapy is needed. Sometimes that animal's just in a pretty rough way, and it may need things to stimulate its appetite, provide some supplemental nutrition, electrolytes, fluids, that sort of thing. Like everything else, it's better to prevent outbreaks of coccidiosis than to try to treat them. Just like stomach worms, we should start with management, sanitation, nutrition. Overcrowding, messy conditions, poor quality feeders, all of that contributes to coccidiosis. Animals that don't get enough colostrum, it puts them at a disadvantage from the get-go. So we want to try to manage it best we can. And don't assume because you have your animals out on pasture that you're not going to have a problem, because a lot of times we create those very same scenarios of overcrowding and messy conditions out on pasture. We can help prevent coccidiosis by putting coccidiostats in the feed, water, or mineral. These coccidiostats don't kill coccidia. They affect the life or the reproduction, so they lower the infection level. Chorid, which is used as both a treatment and a preventative, again, that would require prescription. Bovatec and Decox are FDA approved for sheep. rumensin and decox are approved for goats. They can be put in the feed and or mineral to help prevent coccidiosis. The one thing I always want to make people understand is these coccidiostats, particularly rumensin, can be toxic to horses and to dogs, particularly rumensin, even to sheep and goats themselves. But they are very good options for helping to prevent coccidiosis. Okay, on to the external parasites. I just have this one slide here. Here we're talking about the creepy, crawly things. Ticks, mites, lice, and keds. Ked is actually the sheep tick. What kind of symptoms do we see? Excessive rubbing and scratching, irritation and itching, biting at themselves, losing hair, losing wool, raw areas. In the case of nasal bots, a little bit different than the others. They're a parasite that actually gets into the nasal passages. Nasal discharge, they'll shake their head, teeth grinding, they have their heads low to the ground. Probably more of a problem with sheep than it is goats. So how do you treat these things? Of course, treatment's going to vary to a large extent by what pest we're talking about, what its life cycle is, that sort of thing. We've got two primary alternatives. One is insecticides, which is probably the treatment of choice in most cases. Most of these are permethrin-based. Many of them, but not all, are approved for sheep and goats. In the old days, we used to dip animals. They used to go into a vat and come back out. They still do that in some countries, but I guess modern technology has allowed us to use porons, sprays, dips, and aerosols. The porons are probably going to be the most effective. The other alternative that we have is to use the drugs in the macrocyclic lactone class of dewormers. They do have some effect against external parasites that bite. All of them are, of course, a prescription for drugs. Ivermectin actually is the only one labeled, and it's labeled for nasal bots, but moxidectin should also be effective. No reason to inject them or pour them on because of wanting external parasite control. They still need to be given as a drench. Okay, respiratory diseases. Just got this one slide. Respiratory problems are extremely common in sheep and goats, maybe almost secondary to parasites. In a lot of ways, it's very generic kind of thing. In fact, sometimes they'll call it respiratory complex. A lot of different things can cause respiratory symptoms, bacterial diseases, viral tumors. I actually had a sheep this past year that had a tumor inside, and it eventually pushed it out through her nose. Obviously, that caused respiratory symptoms. Parasites, as I already mentioned, the nasal bot, but also lungworms. And then aspiration. Just, when you simply deworm an animal, you can get fluid down in the lungs. The most common causes of pneumonia are Pasteurella, mycoplasma. You can see the different ones. So pneumonia is typically characterized by a high fever. Keep in mind the normal temperature is about 102 to 103, probably a little bit higher for goats. In our buck test, we use 104 as a kind of a plateau for when we begin treating for respiratory symptoms. So about anything equal to 104 and above. 103, I wouldn't worry about it. Coughing, nasal discharge, difficulty breathing, weakness, death. Those are all symptoms of pneumonia. It can strike fast or it can linger, but like most diseases, it's getting on top of it. Catching that animal when it's got its ears down and it just doesn't seem right, and then you take its temperature and find out that it has a fever. We prevent pneumonia. Again, everything starts with good nutrition, or good management, good nutrition, sanitation. Ventilation is particularly important when we're talking about pneumonia. It was mentioned in a previous class that while in general winter conditions kill off a lot of the bad stuff, sometimes we close our animals in the barns and we have respiratory problems because we don't have good ventilation. There is a vaccination for pneumonia caused by Pasteurella. We talked about that a couple of classes ago. Respiratory diseases are treated with antibiotics. Most of them are not FDA approved for goats. None of them are. And a few of these would actually require a prescription for sheep as well. The I've got asterisks next to drugs that are the drugs of choice. In our buck test, we use X and L to treat respiratory problems. Nuflor is also a very popular drug for respiratory problems, again, prescription drugs. And then, of course, if the animal has a fever, we want to give it an anti-inflammatory drug. That would be something like Banamine, and again, that would require a veterinary prescription. Okay, hoof diseases. These pictures I actually stole from the United Kingdom. They have a lot of foot problems over there. It's not, we do as well, but these are some really nice pictures that show the differences between the three primary hoof problems that we have with sheep and goats. First one is foot scald. And as you can see in the picture, it's an inflammation or redness between the claws of the hoof. So it's not in the hoof. Foot rot is in the hoof. It's an infection inside the hoof. And it can get really nasty, and it has a very distinct odor. It's not that feet ever smell good, but foot rot smells especially bad. We can also get a foot abscess, just an abscess inside the hoof. And while that doesn't tend to be a herd problem, it can be a very significant problem for an individual animal. Okay, let's talk a little bit about each of these hoof problems. Foot scald, the inflammation between the toes, is caused by a bacteria that is present on all sheep and goat farms. Wherever there's sheep and goats and actually cattle, this bacteria exists. Fusobacterium necrophorum. Foot scald is not thought to be contagious because that bacteria is wherever the sheep and goats are. So it's environmental. We see outbreaks when it's wet. It seems to be more of a problem with goats than with sheep. Treatment, you can spray or soak feet, and I don't know so much if I want to call it a drug, but the treatment of choice is zinc sulfate. You can use things like on a one animal, something like copper tox is fine, and I think hoof and heel, there's some products out there, but zinc sulfate is generally the solution of choice. Foot rot requires the interaction of two anaerobic bacteria. The one that's always there, the Fusobacterium necrophorum, that causes the foot scald, but then we've got this other one. And I don't even, Diclobacter noduus, I don't even know if I'm saying it right. But we need that second bacteria to get foot rot. That bacteria walks onto the farm in infected animals. It doesn't affect healthy feet. So if the hooves are trimmed and there's no entry for that bacteria to get in, or there's no cuts or abrasions, there's nothing that's weakened those hooves, it's not going to infect them. And it's only going to survive outside of the hoof for about 14 days. And those factors right there are pretty key to controlling and ultimately eradicating foot rot on a farm. Foot rot is highly contagious, highly contagious. It is very hard to eradicate, and I can tell you that people have gotten out of the sheep and goat business because of foot rot. And it's seasonal, certain times of the year that you see it. So you can get rid of it, and this is one of the diseases we're going to talk about next week. Is it a disease you live with, or is it one you get rid of, and how do you get rid of it? It's a combination of hoof trimming, foot soaking, and culling. I have in parentheses plus antibiotics. In the United Kingdom, they have a little bit different philosophy on foot rot, and they rely heavily on antibiotics. There's a URL there, the University of Maine. I think I've mentioned in previous classes that the University of Maine has a foot health project where they developed a 4-week protocol for eradicating foot rot. And if you bring up that URL, you will see that. A foot abscess is caused by bacteria that's pretty much found wherever. In fact, it causes other things besides foot abscesses. It's usually just one animal. It's usually an older animal, it's usually a really heavy animal, and it's basically treated with antibiotics. And not everyone's successful. Sometimes you just have to get rid of that affected animal. Okay, now we're going to talk about reproductive problems, and a lot of these are really timely because I know a lot of people are lambing and kidding right now. Okay, picture in the picture you see there is of a vaginal prolapse. Okay, abortion. Now a lot of these slides have a lot of words on them. So if you want copies of this stuff, you can download the PowerPoint that's on SlideShare, of which there's a link on the web page. What we mean by abortion is any time a pregnancy is terminated, not intentionally, you have stillbirths, you have very weak offspring that aren't viable, or you have congenital abnormalities. 1 to 5% abortion in a flock or herd is normal. The problem is if you've got 5 sheep, 10 sheep, 20 sheep, it's hard to know how many is normal. I have 3 that aborted. Do I have an infectious cause of abortion, or is it just by chance? So the small flock, it's kind of hard to know, but on a big flock, you certainly expect some of it. There's 2 types of abortions. One is infectious and one is non-infectious. The top 3 causes of infectious abortion are Vibrio, chlamydia, and toxoplasmosis. One of the key take-home messages here on abortion is they are zoonotic, meaning they can transmit to people. So any woman that's pregnant just shouldn't be around the lambing and kidding area. Even though the risk is low, it's not worth it. So those are the 3 primary diseases. There's a lot of other that are far less common but possible, and I've got a list of them there. We can also have abortion from non-infectious causes, nutrition, stress, diseases, just some of the things that can go wrong at the time of lambing and kidding. So what do you do if you think you're having an abortion storm, if you're having too many? Well, protect yourself. Wear gloves, isolate those aborting females, destroy all the bedding and all the materials, thoroughly disinfect the pens. If you think you're losing too many, you should submit samples, the fetuses, the fluids, for necropsy. And the one warning I'll give you about that is you could submit it and still not find out what the cause of abortion was. It's about a 50-50 chance whether you're going to figure it out. But if you don't submit any samples at all, you're not going to figure it. There's a 0% chance you're going to figure it out. If you, at the beginning of the lambing and kidding, you can feed antibiotics or inject antibiotics to try to prevent any further problems. Feeding them is approved for sheep, not for goats. Injections are prescription for both species. How do you prevent abortions? First, and we talked about this the very first class, maintain a closed flock or herd. That is the very best thing you can do. Vaccinate if you're at risk. There's a vaccine for Vibrio and chlamydia for sheep. I don't have any specific knowledge in terms of goats. Vaccinate the replacement females. Most of the time when a ewe or doe aborts from one of these causes, she then becomes immune. She still may shed the disease, but she's immune. Purchase maiden ewes and does. The best way to start a flock is with ewe lambs and doelings, and not with mature ones, from a disease standpoint. Feed an ionophore during late gestation. There's evidence to suggest that rumensin has an effect on toxoplasmosis. There is no vaccine in the United States for toxoplasmosis. That's the one caused by cats. Again, feeding antibiotics in late gestation, good sanitation, and keeping control of those cats, not letting them defecate in the feed and the bedding. And I know that's kind of like keeping a goat out of a feeder. It can be challenging, but what I try to tell people is just don't make lots of kittens. Pick a couple of barn cats, vaccinate them, neuter them, keep feeds in containers, do your best to prevent that from being a problem. Dystocia, difficult births, assisted births. There's different causes for that. I've got it basically broken down into 3 areas. A disproportionate size, meaning you have a big baby and a small female. Malpresentation, everything to the elbow being back, to deformed ones and ones coming all at the same time. Last night I had a ewe that I hadn't assisted any of them, but this ewe wasn't making any progress, and she had 3 breech babies. So actually she had 4. She had 4 babies and they were breech. The 3 of them were. Backwards is normal. If you see a backwards baby, you might as well pull it out, but for the most part it's normal birth. The last thing is ringwomb, which is when the cervix fails to dilate. If you're going to assist, well, one, you need to if after 45 to 60 minutes of hard labor after the water breaks she's not making any progress. You could check her out and everything could be fine and she just didn't read the book. She's going to take longer than the average. But a lot of cases it's indicative that there's a problem. So you check her, see if there's a problem, and then correct it if necessary. Anytime you assist with deliveries, you need to wear gloves or those OB sleeves. You need to use a lot of lubricant. You need to be gentle. You need to apply steady pressure and manipulation. You can do a lot of damage when you're delivering babies. If you've worked on a female for about 30 minutes and you're not making any progress, you should call a veterinarian or somebody more experienced to help. The last thing, not much good is going to come if you keep working on one and aren't making any progress. After you've assisted a female, you should put her on antibiotics. A special case, I have ringwomb. That's when the cervix fails to dilate. Don't pull those lambs or kids. That is only going to come out one way. Dead babies and a dead mama. If it's true ringworm, meaning no cervical dilation, then you need to have a C-section done. Sometimes the cervix is partially dilated and you can spend a little bit of time trying to work it open, but most cases I can honestly tell you no good is going to come if you try to pull those babies through an opening that's not there. A lot's not known about ringworm, but there was a study or research program thing done a couple years ago at West Virginia University, and they thought it did have a genetic component. Okay, prolapses. There's three kinds of prolapse. We predominantly get the reproductive kind, obviously, at this time of year. A vaginal prolapse, which is the top picture, occurs during the last month of pregnancy, usually the last week or two. A lot of potential contributing factors, excess body condition, multiple births, high fiber diets. She prolapsed last year. There is a genetic component to it. What you have to do with that is you have to clean it, put it back in, and hold it in until she lamps or kids. I think these two problems certainly can happen to goats, but I think they're more common in sheep. How do you keep that prolapse in? You can suture it. A vet could suture it. You can use what's called a bearing retainer or a spoon that actually goes inside, and then you tie that to the wool. My preference is to use a harness to hold it in. You can also use like baling twine, similar to a harness. How do you prevent this problem? Proper nutrition. You know, don't make her have a hay. A lot of times what a prolapse is, when you think about it, is there's only so much room in there, and if she's got multiple babies and she's got a gut full of low quality hay, sometimes just something's got to give. Something's got to give. Once she has the babies, the prolapse usually goes back in. Having enough feeder space, not forcing them, you know, to fight for it, and you really shouldn't keep her. She's likely to prolapse again. It happens mostly in younger ewes. And ideally you shouldn't save her offspring because there is a genetic component. The uterine prolapse that you see in the bottom of the picture occurs immediately after, or a day or two, within 48 hours after lambing or kidding. It definitely can be a life-threatening situation. It's usually caused by excessive straining or a very traumatic, you know, birthing, a uterine infection. There's some belief that calcium may play a role, but we really don't know for certain. It's similar in the sense you basically got to clean it and put it back in. And it's very painful, so it really ought to, there ought to be medication to an epidural. It ideally ought to be done under medication. Very often they'll give oxytocin to help relax her because she's going to keep wanting to push. Antibiotics, if everything's done properly, that there's not a genetic component to uterine prolapses, and you can breed her back. And I have done that before. Mastitis is an inflammation or infection in the udder. It's kind of like coccidiosis. There's two kinds, subclinical and clinical. The more costly is probably the subclinical. You don't see anything, but less milk is being produced. It has an effect on production, on performance. You can detect mastitis with somatic cell counts, and CMT stands for the California Mastitis Test. On clinical mastitis, the symptoms the first thing you might see is she might be limping. You check her udder and there might not be any or much milk coming out, or you see kids and lambs that aren't really doing well. You feel lumps in the udder is swelling, it's hot to the touch. And then you just kind of run the gamut all the way to death. She gets depressed, she develops a fever, she doesn't eat, you get gangrene, and she dies. So it can go, again, you know, a whole horizon. The treatment is usually systemic antibiotics and intramammary antibiotics, which are prescription. There's dairy cow treatments, and they are prescription for sheep and goats. And ones, you know, if you lose a side of the udder, you should definitely not keep these animals. The California mastitis test is a way to test for mastitis, for subclinical mastitis. This was actually a slide that Jeff specifically wanted to include in tonight's presentation. He's got a link if you want to see how this test is done. InfoVets, which is a really good resource for sheep and goat health, they have a demo on their website. So it shows you how to do that. The California mastitis test is pretty, you know, it's something that dairy producers quite frequently use. But really, when you think about it, in the meat or fiber business, we probably also have a lot of mastitis that we don't even know about. What causes mastitis is primarily it's caused by different types of bacteria. These are the kinds that have been predominantly identified in sheep and goats. Mastitis is also a common symptom of OPP, ovine progressive pneumonia, as well as CAE, so it can be a part of kind of that symptom complex for those diseases, which we'll talk about next week. The primary cause of mastitis is probably poor sanitation and hygiene and stressful conditions. Like right now, the way the weather has been, my sheep can't ever get out of the barn or don't get out of the barn, so it's made it more challenging to try to keep that clean. Anything that damages the teat or udder makes them susceptible. Poor udder conformation. Those that milk really well are more susceptible. It's age, sore mouth. The biggest risk with sore mouth is having it at lambing and kidding time. And there's also a genetic susceptibility to mastitis. Pregnancy toxemia and milk fever are probably two of the most common diseases with sheep and goats. They are both metabolic diseases that affect pregnant and lactating ewes and does. Pregnancy toxemia occurs during the last part of gestation. Milk fever occurs in late gestation in sheep and probably more likely to be early lactation in does. The animals look very similar in terms of their symptoms. Often it's differentiated by how they respond to treatment, energy versus calcium. If you intervene early, you can be successful. It's usually an indication that there's a herd problem, not an individual animal problem, because they're both nutritionally related. Pregnancy toxemia has a lot of different names: ketosis, twin lamb disease, lambing paralysis. It's caused by an inadequate intake of energy in the late gestation diet, which results in low blood glucose and elevated ketone levels in the urine. As they break down the fat on their back, the byproduct of that is ketone bodies, which become toxic. The first symptom is probably she just doesn't seem right. She goes to the feed trough slower. Eventually she goes off feed. She's very lethargic. She's not real well coordinated. Eventually she goes down. If you catch pregnancy toxemia early and you give her propylene glycol, a couple of ounces several times a day, that can be an effective treatment. If she's a little bit further along, that glucose is given via IV. When it's pretty advanced, you can induce labor or you can do a C-section, because the best cure for pregnancy toxemia is to get those babies out. You prevent it by properly feeding enough energy in the late gestation diet. It's usually necessary to feed grain, especially to high-producing ewes and does. Hays just aren't nutrient dense enough. Thin ewes are more susceptible, fat ones are more susceptible, old ones are more susceptible, those carrying multiple births are more susceptible, timid ones are more susceptible. Milk fever or hypocalcemia is low blood calcium. It's caused by inadequate intake of calcium in late gestation or the inability to mobilize calcium reserves, too much calcium, so not enough or too much. The symptoms are very similar. They go off feed, they're unsteady. Very often they kind of lay out like a frog with their legs splayed out. The treatment is to give calcium. And again, it depends on what stage of the disease you're at. If you catch it early, you can give them oral calcium, sub-Q under the skin, or in an IV. They respond very quickly to an IV. You prevent it by providing the proper amount of calcium in the late gestation diet. In sheep, calcium requirements peak in late gestation, which is why we need to feed more calcium in late gestation. In goats, that's not the case. It's pretty similar throughout gestation, so we don't want to feed too much in late gestation. And then it's very similar to dairy cows. It's more of a problem after, and it's more of a problem of mobilizing the calcium as opposed to the sheep where they're not getting enough. Okay, I want to switch now to metabolic diseases. And the first two we've already covered because they're also reproductive problems. I want to talk about these three primary ones: acidosis, bloat, and urinary calculi. Acidosis is when we get large quantities of lactic acid in the rumen, which lowers rumen pH, and it's caused by a rapid fermentation of carbohydrates, primarily feeding grain, pellets, and byproduct feeds, but it can also occur with really fast-growing vegetative pastures and high-quality silage. Like a lot of diseases, it runs the whole horizon from clinical or subclinical to clinical. It can be everything from life-threatening, that animal's going to die, or subclinical where you kind of don't even know you have it, kind of like mastitis, kind of like coccidiosis. We're getting reduced performance, they're not digesting their feed as well, even laminitis. A lot of times, from a practical standpoint, it's kind of the mild clinical that we're more in tune with, you know, and it very frequently happens if all of a sudden animals accidentally got access to a bag of feed. I remember years ago, a couple of times my sheep were rubbing under my grain bin, and they opened the bin, and the bin, all the grain came out. Well, what do you think they did next? They just started feeding on all that grain. And the symptoms I saw were very much like you see here. They were kind of depressed, and they had the runs, and they were kind of bloated, but it wasn't necessarily life-threatening. The treatment, of course, is to remove grain from the ration. And again, that's particularly as we talk about mild clinical. Feed hay, a good quality long stem hay, sodium bicarbonate or baking soda, antacids, that sort of thing are appropriate treatments, and then treating for some of these other symptoms that you may see. The way we prevent acidosis, and this includes the subclinical kind, is to have a gradual adaptation to a high-starch diet. There's nothing wrong at all with feeding grain to ruminants. We simply need to give them time to adjust. We need to introduce grain slowly, and we need to increase it slowly. We do not want to crack or grind grains for sheep and goats. The only exception is the very young, you know, a creep feed. You know, when they're 2 weeks old, they can't process those grains yet. But for the most part, we do not want to crack or grind grains. There's a lot of different feed additives that can help with acidosis. And in a lot of cases, we're looking at preventing that subclinical acidosis. We've mentioned, I think, in previous classes how people have fed baking soda or sodium bicarbonate. Limestone ionophores. And ionophores are that rumensin and bovatec. We think of them as coccidiostats, but they have so many other beneficial effects. So antibiotics, there's a specific antibiotic. Yeast is being looked at. All of these are kind of rumen modifiers that can help with that subclinical acidosis. One of the diseases, while we're on acidosis, that I actually forgot to include was floppy kid syndrome, where the kid's just kind of, just like he sounds, it's like a floppy noodle. That's actually a metabolic acidosis, and you actually treat it with sodium bicarbonate. So it's somewhat related to this topic, and I completely forgot to include it in tonight's presentation. Bloat, sometimes acidosis and bloat can look similar. It's an accumulation of gas in the rumen and reticulum. The animal's unable to belch. If an animal can't belch, a ruminant can't belch, that can be life-threatening. There's two different kinds of bloat. One is the frothy bloat, where basically you get a formation of a foam. This is associated primarily with grazing legumes such as alfalfa or clover. It can also be with wet grass pastures, that early spring, cereal grain pastures, garden greens, even grain. Then we get the free gas bloat, which is more like kind of a feedlot bloat, and it's a result primarily of high grain diets. Kind of within this same topic is abomasal bloat in an artificially reared lambs and kids. When we're bottle feeding them or feeding them on a milk bar, we can get bloat, and that's in the abomasum, but treated very similar to the other types of bloat. Bloats, again, like everything else, the severity varies. It can be life-threatening or self-curing. They actually did a study, I think, out in Utah that shows that animals, when they graze, they know how to self-cure. You know, if it's starting to make them bloat a little bit, then they know to eat something else, so they know what to eat. So it can be life-threatening or self-curing and kind of everything in the middle. When we see an animal that's with bloat, we'll see the abdomen is distended. There'll be swelling on the left side. It'll be fairly obvious to us. How you treat it, again, depends on the severity. In extreme cases, you can pass the stomach tube. For free gas bloat, a lot of fairly mild bloat is treated with vegetable oil, mineral oil, or an antacid. I'll get, in the early spring off of wet grass, I'll get ewes that'll bloat, and I'll just give them, I give them my Lanta, which is an antacid. You got to be careful thinking that sheep and goats die of bloat, because to some degree, particularly with certain diseases, they will appear bloated when they die. Prevention is very similar to acidosis. Introduce them to new feeds or pastures very slowly. For example, if you've got a nice alfalfa pasture or a really lush pasture, fill them up on dry stemmy hay before turning them out. There's also products that you can feed as preventatives. There are different commercial products. Again, the ionophores, the rumensin, the Bovatec, the baking soda, all of those are good. And as far as preventing it in the young lambs and kids is proper milk feeding. One of the advantages of cold milk is they won't tend to overeat. But mixing things properly, not letting it spoil, things like that to prevent the bloat in the young lambs and kids. Urinary calculi, we call that water belly. It's a blockage in the urinary tract by calculi, which are kidney stones. It's most common in wethers, but also intact males are susceptible. And it's caused by improper feeding. A lot of people want to say, well, it's caused because you castrate too young. No, it's caused by improper feeding. It's generally too much phosphorus in the diet. The symptoms are they get very restless and anxious. They go off feed. You're going to start to notice that they're in pain. They're humped up. They can't really pee. They're straining to pee. Maybe a few drops are coming out. Eventually, their abdomen will get distended. Eventually, the bladder can burst and kill them. How you treat the disease depends on where the location of the obstruction is or how early. Sometimes you can drench with ammonium chloride drench to clear things out, and other times you need a surgical intervention. Sometimes a simple one, sometimes more complex. If it's a valuable animal or an animal that you have emotional attachment to, you may go the surgery route. In most cases, sending it to slaughter quickly is probably the best thing. It's often not very rewarding. You prevent it by feeding a properly balanced ration. The calcium to phosphorus ratio should be at least 2 to 1. This is particularly true when you're feeding wethers and males. You need to make sure they have forage in their diet. You need to make sure they drink enough water. And most of the commercial feeds will have ammonium chloride added to prevent urinary calculi. But it's a nutritional thing. It's why it's so important to balance rations. Why it's so important if you buy a complete feed, you know, a 16% goat feed, that you don't go put 50% corn in it and 50% the goat feed. You don't unbalance it. Grains have very high level of phosphorus relative to calcium. Forages, the ratio is different. Legumes, of course, are a pretty decent source of calcium, so you need to balance that ration. If you don't want to take the time to balance the ration, then buy the feed that's already been balanced. A couple of neurological problems that are common, and the thing I want you to keep in mind is there are other diseases that cause neurological symptoms, scrapie, rabies, meningeal worm, pregnancy toxemia, enterotoxemia. All of those can present with some neurological symptoms. These are probably two of the more common ones. The first one is listeriosis. We call it circling disease. It's caused by a bacteria. The bacteria is everywhere in the environment, but it tends to get into sheep and goats primarily through spoiled feed, specifically silage, but certainly not limited to silage. The symptoms are actually pretty easy to recognize. They're paralyzed basically on one side. They're disoriented. You'll see that ear will kind of be down. They'll be drooling and slobbering on that one side. They won't walk around you. They'll lean against objects. They essentially do walk in circles. It can also cause abortion, but primarily we see this circling disease. If you catch the disease or the symptoms early enough and you give an aggressive antibiotic therapy, usually penicillin or tetracyclines, you may be successful. I would say in most cases people are not successful, but if you get it early enough you may be successful. Polio is another somewhat common problem in sheep and goats. It's basically a disturbance in thiamine metabolism, which is vitamin B1. Tends to be associated with concentrate diets, which lowers the rumen pH, diets that are high in sulfur. You'd have to feed a lot of chord or amprolium, but that is a risk factor. Anything that affects the ability to utilize thiamine, because thiamine, like all B vitamins, is manufactured in the rumen. And so it's not so much a thiamine deficiency as something that's messing with the thiamine system in the animal. Symptoms are somewhat obvious, although again similar to any of the diseases that cause neurological symptoms. They go blind. The stargazing means sometimes they tilt their head and just kind of look up. The head pressing, they're blind. Much like listeriosis, if you get it early, you can be very successful. High doses of thiamine, prescription only. Not B complex vitamins. It doesn't have enough thiamine. You need pure thiamine. Usually, if you catch it early enough, you can have a complete recovery. They can fully get their sight back. Occasionally, you save their life, but they're still blind. Occasionally, that does happen. The key to any of these diseases is identifying them quickly. We're winding down here. I think this might be just two more diseases. Pink eye. It's infectious, it's contagious, it tends to occur as an outbreak in a flock or herd. Many organisms can cause pink eye. Those are the common ones listed there. It may start with a discharge from the eye. It may be like a dampness below the eye. The animals don't like to be around light. The membranes are going to get red and irritated, and the eye is going to get cloudy or dark. What you should do with these animals obviously is isolate them, put them in a shed or an area where it's not sunny, and it's treated with antibiotics. It's bacterial. It's treated with antibiotics. Common treatment is terramycin ophthalmic ointment. Ointment comes in a little bit of tube. Pink eye is also treated with LA200, penicillin. Even those tubes that are used for mastitis are common to treat. All of that would be prescription only. How do you prevent pink eye? You maintain a closed flock or herd. You quarantine any new animals, and when your animals return from the show, you quarantine them. Pink eye tends to walk through the door, off the truck, into your farm. Doesn't mean you won't occasionally get an animal with an eye infection that's maybe not caused so much by a bacteria, but more of an irritation. That does happen. You do treat it the same way, but here we're talking about outbreaks of pink eye, and biosecurity is the best protection. I think this is the last disease, and that's sore mouth or ORF. It's the most common skin problem in sheep and goats. It's caused by a virus in the pox family. Virus means it won't respond to antibiotics. It's highly contagious to other animals, very contagious to people. The symptoms is the lesions, much like you see on this picture. Typically you see lesions on the mouth, but they can be on really any extremity, nose, feet, limbs, udder, and their genital areas. They can be everywhere. It just depends. But mostly, like I said, it's up around the nose and the mouth. Do nothing, which is basically all you can do. It takes about 1 to 4 weeks for the disease to run its course. You'll start out with little pustules on the lips. Eventually you'll get the blisters, then those scabs will fall off. Those scabs, if they're exposed to the sunlight, probably die off pretty quick, but if they get inside a building or I figure in our little porta huts at the research center, we're liable to have some scabs in there that have survived. Treatment's generally unrewarding because, again, it's a virus. Some people have claimed some efficacy with WD-40, which I'd be willing to give a try. But most other things, I suppose it can't hurt, but for the most part, it's just going to run its course. If you get a secondary bacterial infection, certainly you want to treat it. If it's a very young lamb or kid that's affected, sometimes it can really drag them down, and you need to give them some supportive therapy. You prevent sore mouth by maintaining a closed flock or herd, by quarantining new animals and any animal returning from a show. Once you're infected, you can use the vaccination to control outbreaks, just like we talked about, I don't know, 2 or 3 classes ago. The point of sore mouth vaccination is to give them the disease, but to give it to them where and when you want to keep them from being a problem during lambing and kidding, to keep it from being a problem taking them to the shows. You need to wear gloves when you're vaccinating and handling these infected animals because, again, people can get it.